This is Medical Spa MD. Hello there and welcome to the show where we give you the inside information and the word from the experts to help physicians take control of their medical practices and lifestyle. Even if you're clueless about running a business and you're already working 60-hour weeks, Medical Spa MD is brought to you by medicalspamd.com, a worldwide community of physicians practicing cosmetic medicine. Hello, Jeff.
Hello, Andy. How are you doing today?
I'm very, very well. This is episode 4, isn't it?
It is. It is episode 4.
So what's been happening, Jeff, in the medical world? I saw an interesting post here on Allergan. What's the story with Allergan? $600 million poorer.
Oh, yes. Well, Allergan kind of got their hand caught in the cookie jar, and the federal government decided to slam the lid down a little bit. Evidently, according to the FDA, Allergan had been paying doctors millions of dollars and teaching them how to miscode the drug Botox to be able to use it for off-label treatments for which it had never been approved. And
now, miscoding, Jeff, is this basically how it's classified?
No, what they were probably doing, and I've only seen the news report, so I don't know exactly what happened inside of the courtroom or whatever happened between the lawyers, but they were probably teaching physicians how to code for something other than what they were using the treatment for. Now, in the U.S., when you have a third-party payment system, the physician will code the treatment that he is performing. There's a code for literally every treatment. And so there are things that Botox is approved for, migraine headaches and other kinds of things. But if you are treating somebody for wrinkles around their eyes and you are coding that as though you're treating them for migraine headaches, that's, in effect, miscoding that treatment.
Okay. So it's more to do with the way that the drug is being used, is it?
Yes. Now, off-label usage is legal. A physician, once a drug has been FDA approved, can treat with anything that they actually think the drug might be effective for. An MD or a DO has very, very kind of wide latitude as to how they kind of go about that and how they decide what something is going to be treated for. However, they kind of came down, and that was the judgment, or Botox ended up having to pay $600 million. Now, they are somewhat closer to a number of potential approvals for other uses, but that is a $600 million little slap on the wrist that Botox or Allergan got from the FDA for sure. That's got to hurt.
Yeah, yes, I should imagine it will hurt. Well, moving on, a bit later in the show, we've got, you interviewed Adrian Richards, didn't you? We'll talk about Adrian in a minute, but I've got a question for you. How much do you use social media and things like Facebook?
Well, we are actually using it a lot. And in fact, the community, Medical Spa MD, is now extended and we're integrating with a number of other things. We have groups on LinkedIn, and we have both, Medical Spa MD has a fan page on Facebook, but we are also starting a number of groups on Facebook in order to teach or to, involve physicians who are interested in a very kind of specific learning inside of the medium that we're teaching. So, for example, we have a group on Facebook that is called Physicians and Facebook Marketing, How to Do It Correctly. And so our staff, as well as other physicians who are marketing on Facebook, belong to this group and help teach physicians how to do Facebook marketing on Facebook. Now, it's very common that physicians now, or medical spas or whatever, will have a fan page or some other kind of thing because they realize that their patients, there's now 500 million members on Facebook. All of their patients are on Facebook, and it would be very appropriate and a great marketing tool to be able to get in front of them. But they do it poorly, very, very poorly. So you'll often see a medical spa that might have had 10,000 members or 10,000 patients come through its doors in the last 5 or 6 years, and they've got 50 friends on Facebook, which is literally, I mean, it's just pathetic. And the reason is that they're not building a community. They're not providing any value. They put up links that are endlessly, come in Friday and we'll give you, free bananas, whatever. I don't know what they're doing, but it's just piss poor. And so we got a lot of inquiries around this kind of stuff. Where often when speaking with physicians, they'll also kind of talk about this just a little bit, like, what should I be doing on Facebook, or is Twitter any good for me, or that kind of a thing. And so we decided to start a number of groups. This is the first one, Physicians in Facebook Marketing, on Facebook, in order to kind of teach them how to do that. So if you're interested at all, it's not necessarily physicians only. We are going to be teaching how to market on Facebook and how to grow your business that way. But our focus, of course, is for physicians.
I know this is very early days, Jeff, but what sort of, how do you think it's going so far?
It's going really, really well. I know that I've got a couple of people that are going to be literally teaching inside of this group that I respect a great deal. I'm going to be actually in there. We've been very successful in with growing a number of businesses through Facebook. And so we're going to share that information with our community. And really the nice thing about it is that it extends the community past only medicalspamd.com, which will probably always be the main portion. But you can literally go to Facebook and sign up and become a member of the community and stay on Facebook and derive at least some of the value that all Medical Spa MD members get. So like the sign up form is now on Facebook. We actually sign physicians up who find us through Facebook and have never even seen the site. So those are the types of things that we're also going to be teaching how to do for physicians wherever they are.
Interesting stuff. Right, let's move on to that interview with Adrian Richards. Now, I actually have known Adrian for about a year now, and he's a very interesting guy. I suppose he's a lot like the people you interview over here, but the English version, Jeff, because he's very much into the social media side of things.
That's very true, and there are some very striking differences between medicine in the U.S. and medicine in the U.K. or the European Union, and we talk about those quite a bit. One of the things that I thought was very, very interesting, and had never really known this, was that a title for a surgeon in the U.K. is Mr.
What do you call him in the U.S. then?
Well, we call him Doctor.
Okay.
And, there's just some very kind of striking differences that I think pretty much everybody would find very interesting in this interview. And he's a great guy. He's really embraced social media. As you know, he's got like 5 different podcasts that he does. He runs, I don't know how big that clinic is, but they've got 4 or 5 locations. And I think it looked like 8 physicians, cosmetic surgeons and dermatologists working at these locations. So it's a rather big practice, and very interesting to understand how he goes about harnessing his marketing efforts, which he's involved in because he likes it a great deal, and how he's kind of started that and what the results have been for him, which have been really good.
Okay, well, let's have a listen to that interview now, Jeff, with you speaking to Adrian Richards, who is a cosmetic and aesthetic surgeon.
First thing, Jeff, is that in the UK, I don't know if your listeners know that surgeons are actually called Mr. rather than Doctor, which is different. Yeah, different from the States, isn't it?
And how did that kind of come about? Because I did notice that on your site, you have, it looked like maybe 8 physicians, and they were all a Mr. except for one who was a doctor as a prefix.
Well, basically, over here, you either sort of decide after you qualify as a doctor whether you want to go down a surgical route, you call it, don't you, or a medical route. And if you go to follow a medical route, you may be a chest physician or something, you'll stay as a doctor. If you go down the surgical route and you take the surgical exam, which is called the Fellow of the Royal College of Surgeons, when you get that, you actually revert back to a Mr., or if you're a lady, a Miss. And the reason for that is that in the early days, 400 or 500 years ago, surgeons who sort of amputated limbs weren't medically trained. They often were sort of barbers, like Sweeney Todd the barber. they were sort of doing those procedures. So it's just sort of traditional. You know how we are in England. We're sort of just very traditional, and that's the way it's remained.
And so your patients refer to you as Mr. Richards?
Yeah. So I was a doctor. So I qualified. I was a doctor for 6-7 years. Then I got my surgical exams, and then you revert back to Mr.
That's striking to me, because in the U.S., physicians are really trained in medical school to kind of take control of a situation and, in effect, set themselves slightly apart as an authority figure.
Well, in the UK, in England, people know that your surgeon would be Mr. They will be worried if they were operated on by a doctor. They just know, Mr. Stanley is doing my varicose veins. They expect it to be a Mr. They associate the word Mr. with a surgeon. It's a very different training. Basically, we start medical school at the age of 18 normally. We start earlier, so we don't go to college. So there isn't really a college system. We would go straight into university at 18. We spend 5 years at medical school, and then after that, sort of the age of sort of 23, that we qualify as doctors, which I think is earlier than in America. Then we do some sort of basic training, to really sort of find out what we wanted to do before you decide on your speciality. But our training would be longer. So, for instance, I qualified in 1988, but I didn't become a consultant till 2001, which is 13 years. So it's 13 years after becoming a doctor until I become a fully qualified plastic surgeon. So although we start longer, our actual training to become a plastic surgeon is longer.
And so are there fewer plastic surgeons in the UK than there are per capita in the US? Do you know?
Oh yeah, way lower. I mean, there were only, until about 10 years ago, there were only 200. So for 60 million people. So, I mean, that's had all sorts of implications on the industry over here. And one of the main differences in America, in the US, is there's always been quite a few very well-trained plastic surgeons. So each city would have a lot of plastic surgeons. My father lives in Philadelphia. I know there's way more plastic surgeons per capita than there are in the UK.
So you've got universal coverage, which we're just moving to in the United States. And so the fact that you're in retail cosmetic medicine or elective medicine, how does that kind of fit in with, the general practice of medicine in the UK?
Well, basically, we have a system called the NHS, which is the National Health System, which was really set up after the Second World War, because after the Second World War, the standard of healthcare wasn't very good in England. So they set up so it's called the NHS. So basically, if you're ill, you're having a child, it's all covered. No one has to pay anything. You just go along, any sort of injury, whatever, you get paid. Now, there are things around the edges which is a bit blurred. So, prominent ear correction, breast reconstruction after cancer, varicose veins, hernias, carpal tunnel syndrome. Those sort of things have traditionally been covered. Even, when I was training, breast reductions, breast enlargements, those sort of procedures were performed on the health system. But they're tightening up a lot because it's costing more money. The system, is very expensive to run. So they're tightening up a lot on the sort of procedures which aren't medically necessary.
And so your practice is predominantly cosmetic surgery, as I understand it. Is that correct?
Yeah, well, what happened, also, in 2001, when I qualified as a plastic surgeon, what happens is you're taken on by a hospital as a consultant plastic surgeon And then in those days, I was taken on by Stoke Mandeville, which is one of the main regional plastic surgical centres, which had a big burn centre, a big spinal injury centre. So I used to do a lot of hand surgery, a lot of breast surgery, a lot of burn surgery, an awful lot of that sort of thing. And I also had worked sort of 1.5 days as a private surgeon externally to that. And I just found I was getting too busy on the other side. So I sort of, after 5 years, left the health system to work